Hey, it's Alvin from Priceline Pharmacy, West Brunswick for the Ask Alvin show. We're up to episode number 6. Can't believe it. Thank you for all your support. Before we start, just want to make sure that you subscribe to our channel, like the videos, and make sure you leave us any comments below, any suggestions on what you want done, and whatever you want me to cover. Maybe you want me to do this show at a different time. We've been mixing it up, trying different things, different days. If you have any suggestions for us, we would really appreciate it. For those who haven't come on the show before, this is just a quick Q&A session where I answer any common questions that you may have about pharmacy related matters and things. We're going live, so if you're coming on live, you can ask me a question in the comment section and I'll do my best to answer them for you. Just with everything that we cover here today, remember this is general advice. You should always seek professional medical advice with reference to your particular condition and your symptoms. And with any medicines that I talk about, you should always use as directed and consult your healthcare professional if your symptoms persist. So we've got some great questions as always today. So the first question that we have is from Jeff. Jeff wants to know how to clean his spacer. So just a little bit of a background for those who may be unfamiliar with what a spacer is. A spacer is one of these devices that we use, some asthmatics use to help deliver their inhaler. They're either Ventolin spray or Seretide spray. And that's what it looks like, and you always recommend that you use a spacer because it delivers more of the medication into your lungs and it just works a million times better. Maybe perhaps one time I can go through with you guys if someone has a question on how this all works, but particularly for Jeff, he wants to know, how do I clean the spacer? So spacers, being plastic, they can get a little bit grotty over time. It's really important that you keep it clean. So the best way that we recommend that you do it is you rinse your spacer in hot soapy water, and you just rinse it out with hot soapy water, rinse it out with some more warm water afterwards, and you let it drip dry. We don't recommend that you rub it dry, or like you normally would any other dishes that you wash, because by rubbing it, it creates a static charge, and when you go around to start using your inhaler, through this device, it'll stick to the sides of the spacer. That's why we recommend that you just rinse it in warm water and then you let it drip dry on your dish rack or whatever until it's dry, and then it's good to go. So hopefully, Jeff, that answers your question about how to clean a spacer. Jonathan asked for the second question, any tips you got to help me treat my diabetes? Again, Jonathan, can't really go into much depth of detail here for you, but I think I'll be safe because of all this legal stuff. But best thing would be, I'll be giving you some general advice, and the first thing is to look at your diet, because if you've got type 2 diabetes, diet plays a really big component of managing that. And the first things I would start with would be to look at your carbohydrate consumption, your refined carbohydrate consumption, and also your sugar consumption. That's what I would be looking at to help you manage your diabetes. You can use a couple of over-the-counter things, but I'm sort of reluctant to mention those because I don't know your specific conditions there, Jonathan. Oh, and I forgot about exercise, of course. So those two things there. So diet, exercise, the two main things. And in a high majority of our patients and clients, we can get the diabetes under control if we get onto it early. So some of the stuff that you might want to avoid when we say carbohydrates, stuff like pastas, noodles and bread are some of the main culprits. There are certainly different types of breads and pastas and noodles. If you do enjoy those kind of foods, which who doesn't, you can get some great alternatives. In terms of sugars, you want to stay away from the refined sugars as well, because that'll just send your blood sugar levels through the roof. Jonathan, hopefully you got some value out of there. Of course, please come in and see us. We can just give you so much better advice if you come in and speak to one of our wellness consultants or pharmacists. And once we know a little bit more in depth about your condition, we can help you come up with a treatment plan. And there are certainly some over-the-counter and natural items or medications that we can use as well, or if you just need to get your blood sugar tested, we can do that as well. Cool, hope that answers your question there, Jonathan. Nick asks, how do I treat warts? Well, there are different types of treatments for warts. Great question, Nick. So what we have for warts, there are two different types of treatments. Probably should take a step back and talk about warts. So warts are a viral infection that we all have, or the virus lives in our skin, and usually when the warts come out to play when there's a constant pressure being applied, or when they've been irritated, when the skin has been irritated in some prolonged way, and the warts come out. So the best way, there's two methodologies of treating it. One you probably see in the pharmacy. There is a wart paint and a wart freezing off product kind of option. As I said, Nicholas, we need to make sure that those treatment options are appropriate. They're not really appropriate for diabetics because they tend to eat away at the skin, and once they eat away at the skin, you risk the chance of having an infection, and you get a whole other set of dramas from there. So, Nicholas, so there's to answer your question, two different types. There is the liquid, liquid and ointment, which contains ingredients like salicylic acid and podophyllin, which you can put onto your skin. It's really important that you surround the wart with some Vaseline or something like that, like the Vaseline old school ointment that stops the wart treatment from running onto the good skin, and usually you need to apply that on twice a day for a couple of weeks or so. The other option that's really popular is, and that's the more convenient option, is using the wart like a freezing type option, which you can get in a canister nowadays, and that basically you just put it directly onto the wart, and that sort of kills the wart, and the surrounding skin underneath it kind of like freezes it off, and then and the wart drops off over the next 7 to 10 days. So that's how we treat warts, Nicholas. Those two different types of things you can use, products you can use, but please come in and see us because we need to make sure that that you can take them. Tony asks, how do we treat bee stings? Okay, so Tony, the most common way that we treat bee stings if you come into the pharmacy is we'll obviously assess you and just make sure that nothing else is swollen, or typically with a bee, some people are highly allergic, and then you get swelling of the swelling of your throat. If the breathing goes, and we'll be calling 000, getting you to a hospital, a doctor straight away. But a simple bee sting where you've just got some inflammation or swelling where you've been bitten and some red blotchy spots, and it's super itchy. Our treatment protocol is to use an antihistamine. So yes, the same antihistamine that you use with hay fever. They can also be used for an allergic response. Very effective. We can give you a non-drowsy one, which will start to work within an hour or so. So you will need to use an antihistamine for the next few days. Along with the antihistamine, we use a low-dose cortisone-based cream to apply directly onto the bites, because that reduces the redness, the itchiness, and settles down any swelling as well. And that works really well for settling the redness down. So sometimes some people get multiple bites, and if it's a larger area, we'd probably recommend you go to a doctor. But obviously, we'll assess these things when you come in. So Tony, hopefully that answers your question on how we treat bee stings. Cool. It's 4 questions, guys. Remember, disclaimer again, this is just general medical advice. Please contact your healthcare professional to get a treatment plan that's pertinent to you. And also, anything I mentioned about medication, please always read the label and use only as directed. Come in and see us so we can go through how we can help you with your individual health condition. So please make sure that you subscribe to this video, share this video, get the word out there if you find value in what we're doing. If you have a question for next week, please make sure you put them in the comments below. If you have any suggestions on how we should do this, put them in the comments below. Do you want me to do this in the shop or rather than in our consult room? Any suggestions are always appreciated. Yeah, thanks for tuning in, and we will see you and speak to you next week. Thank you.